Hey guys, wish you all a very good Wednesday morning. And I'm going to cut straight to the chase. If you are someone who does not like experiencing pain and you're also someone who wants to avoid painkillers, then this is a very interesting video for you because I will be talking about the anti inflammatory potential of your own blood, which is harvested as PRP or platelet rich plasma. I'm Dr. Santosh Jacob. I'm an orthopedic and sports surgeon from the beautiful city of Chennai, which is in Tamil Nadu, India. I have an orthopedic and a sports injury practice, and I extensively use platelet rich plasma, bone marrow, and also fat cells to treat a lot of anti inflammatory, to treat a lot of inflammatory arthritis, and also sports injuries, especially partial tears of ligaments and muscles. So, an article of mine came out in a Tamil daily called Dinatandi, and I had many questions which were asked by audiences, and I have chosen the top 5 questions and also added a last question of mine, which we will start right now. All right. So, for all of you who are watching on LinkedIn and FB and also YouTube, welcome once again. And I hope you find all the information useful. All right. So, the first thing which was asked primarily is what is this platelet rich plasma? Why are we hearing so much about it now? Now, so let me just take you back straight to your childhood. Okay. So, you've just cut your hand, okay, and blood is oozing out, okay, and you do not know what to do, but everybody wants to stop the bleeding. So somebody tries to put some tea, some sugar, some turmeric, something, and finally, after 2 to 5 minutes, your blood stops, it clots. And immediately, when somebody elder came and they saw that your blood had already clot, there was relief on their face. They knew that once platelets, the clotting agents which are in your blood, break down, disintegrate, and stop the bleeding, healing will start or healing has been initiated. Now, you will also remember after it clots, it becomes yellow, it becomes really brown, it becomes like a hard scale, and afterwards, like magic, it just peels off and there is new skin. Platelet rich plasma is just taking platelets out of your blood, removing the platelets alone, breaking them down using some enzymes, centrifuge, or ultrasound cavitation, and activating the platelets. Once it is activated, the platelets are delivered through an injection or an arthroscope or a probe into areas in your body where you need healing. So basically, platelet rich plasma is the clot which generally happens once you have stopped bleeding and your healing has started. The only thing is we concentrated twice or thrice the strength of your natural clot. And that is what platelet rich plasma is. It is your platelets, which all of us have, separated, broken down, the goodies inside them activated, and that applied or delivered or injected to areas of disease. So it's the simplest way to explain what PRP is. Now, going to the second most asked question, how do you prepare PRP? Is it very painful? Will I have any bleeding after that? Any swelling? What is it? What's the technique? So it is really, really simple. So once you decide on a PRP treatment, you have to do a blood test where we see if you have an enough or a standard amount of platelets in your blood, okay? Because we are going to be concentrating it. And depending upon how severe your problem is, either 15 ml, 30 ml, or 60 ml of your blood is taken. And it is taken from your veins. It could be in the hand, in the elbow, or if you want it under anesthesia, it is taken from your femoral vein. So it's just a standard way of taking blood, just like in a lab test. And after that, the blood is passed through a series of centrifuges in a kit. And after the processing, from 15 ml of blood, we will get a highly concentrated 2 ml of platelet rich plasma. And this is how PRP is actually prepared. It takes around 30 minutes in order to process 15 ml of your blood into 2 ml of platelet rich plasma, which is ready to be injected to treat you. Then, question number 3. Of course, what are the conditions that can be treated and how many times can you repeat this treatment? Now, platelet rich plasma is an anti-inflammatory solution which is harvested from your blood, and evidence shows that it reduces inflammation, starts regeneration, it activates the existing stem cells in the area, and it also causes chemotaxis. So chemotaxis is an activity which happens when you want to attract healing cells in a place of injury. Okay, so PRP also does that. And as a result, you can treat any condition which is an inflammatory condition. I will give you a simple example. Osteoarthritis of the knee, knee pain, or low backache. Okay, so we have identified already that if you have osteoarthritis, knee pain at 55, or if you are requiring a knee replacement at 60, your osteoarthritis did not actually start at 58. It started 15 years ago, and it didn't start inside your knee. It started 1 centimeter below the surface of your knee as an inflammatory change. That is, proteins which caused irritation in that area started to be produced because of many reasons. Okay, it could be genetic, it could be your work, it could be your nutrition, okay, it could be an injury, something. And that over a period of years started to cause changes in the surfaces of the knee. Okay, so here PRP can be applied in any place where you have pain which is because of an inflammatory cause or an injury. PRP, is it alternative to knee replacement? No, they're very different. Okay, that was the 6th most asked, so I'm just going to explain it anyway. See, a knee replacement is a surgery which is done for alignment, change of alignment of your knee. We actually shave off parts of the knee and we realign your entire length from the hip up to your ankle. If your knee is curved, it becomes straight in a knee replacement. As of now, no injection or no arthroscopy. Okay, there is a surgery known as an osteotomy, which also gives similar results to a knee replacement. But other than that, there are no injections, nothing, no lubricants which can actually change the alignment of your knee. So when we talk about PRP, we are only talking about pain relief in severe cases or reduction of inflammation. Say somebody is not yet ready for a knee replacement, okay, and they are diabetic. They can't take a steroid injection, or they know that steroid injections worsen the knee and they want an alternative. PRP is an option for them, especially in advanced arthritis. But where PRP really works is sports injuries, acute or chronic, frozen shoulder, okay, neck pain, low back pain, especially if you don't have a very severe disc bulge, okay, but it's irritating you constantly. Heel pain, ankle pain, knee pain, chondromalacia patella, partial outer tears of the meniscus. It works anywhere which we can identify, okay, that is the area where we need to inject the PRP. It can be done using an ultrasound very beautifully, especially in the shoulder. You can actually see the tears and inject it inside the tears. It's really, really good. So any place where it's not very severe, very progressive, and you can identify that yes, this is the region of the pain, okay, and there is no other gross pathology, definitely PRP can be used. Finally, side effects. Very commonly, swelling in the area, pain afterwards, redness. Sometimes the pain even lasts for 2 to 3 days. But all this is common, okay, because PRP restarts inflammatory healing in the area. So icing, I prefer icing the area so that any medication, especially anti-inflammatories, which we take for pain after a PRP injection, could actually reduce the efficacy of a PRP shot. So that's the thing. For 2 to 3 days, you might have some pain or discomfort. Fine. Okay, this is actually my question. Why should we be excited about platelet rich plasma? See, the first thing is platelet rich plasma is harvested from your blood and injected into your organs which have any diseases. Okay, so it's just us assisting our bodies to heal ourselves. It's the perfect example of renewable health. We are all talking about renewable energy. PRP, I think, is the simplest way we can connect to the renewable energy which is available in our blood. It has everything. You just have to identify it, redirect it into your diseased regions. Okay, that's why I'm really excited about PRP. Two, the blood which is taken, even if it is 60 ml, is completely replaced in 6 weeks' time. So you don't have to worry about the blood loss. Third thing, PRP actually, inside the platelets, there are proteins which are called growth factors, like vascular endothelial growth factor. So, vascular endothelial, I'm just using this name because it's self explanatory. It helps microcirculation to regrow. And PRP has a lot of VEGF. Similarly, it has other growth factors which regenerate, help regrow tissue, divide cells in its repertoire. So it's a natural way that we allow our disease to respond to our body's healing, because we take the growth factors and we deliver it in the area of the disease. There's no cutting, opening, there is no human intervention. It's just your healing taken. The human intervention is I accurately deliver it in the area of the disease. That is it. And finally, if you are somebody like me, I'm a diabetic. I became a diabetic when I was 38, like my dad, and I was also quite careless with my diet. Let's be very honest. I didn't exercise when I was young. Right now, I know as a doctor that if I'm a diabetic, my eyes and my kidney is under stress, and my nerves also. But primarily, I as a doctor, I know that you need to protect your kidneys. And I also do not want to take any steroid shots, because everybody knows that diabetes is aggravated by steroids. And I love to move. As I grow older, I'm going to have issues which will motivate or make me reduce my movement. That is the point of time where, without taking any medications or reducing the use of anti-inflammatory medications, which all of us commonly take, PRP will be very, very useful, especially for those of us who are moving a lot and exercising, because injuries are the reason why we stop moving. And come on, who wants to have a surgery just to continue running? Very few of us, very few of us. So this is the idea. This entire live was to just educate, you about the fact that your blood has a lot of healing in it. Wherever you are, whichever city you are, talk to your orthopedic or your sports surgeon about it. Find out who has regenerative experience and talk to them about it. I'm sure all of them will be really, really happy to guide you about what this is. All right, guys, I think I am done. Thank you so much for watching this with me live, and also all of you who will be watching the reruns of this. Thank you so much for spending your time. Also, if you found this content interesting and useful, let me know in the comments below, and also like, share, and do subscribe. All right, guys, signing off. Thank you once again for watching. Dr. Santosh Jacob. Bye-bye. All right, I'm just going to go and look at the comments to see if I can. Yeah, so Dr. Dinesh has asked about how to prepare PRP. Yes, I will do that. And he also asks about, yes, I said something about icing the area. So like there is a treatment called cryotherapy where post any surgery, any arthroscopy, or any treatment, it's a wrap which goes around the area and it circulates cool air or water. This reduces post surgical inflammation, especially in arthritis, especially in arthroscopies, where there isn't an open incision there. So you can also do the same thing by ice therapy, icing the area. Even if you have an ice pack at home, you can just wrap it around a towel and ice the area post a PRP treatment. All right? Okay. Thank you guys so much once again. Bye-bye.